much does diet impact our brain health? Sue Saville visited the Cyprus Institute of Neurology and Genetics to understand how the Mediterranean diet could be adopted as a controllable measure to prevent and improve neurological disorders.
Typical ingredients of the Mediterranean diet: fish, vegetables, grains, pulses, unsaturated fats like olive oil, already known to have a protective effect against chronic conditions like cancer and cardiovascular disease. And now evidence is mounting of their benefit to brain health. The impact of the nutrients found in the Mediterranean diet on neurological disorders is being studied here at the Cyprus Institute of Neurology and Genetics. And the results so far are very promising.
This is a brain MRI that we see.
Dr. Eleni Zamba Papanikolaou monitors the rate of neurological degeneration in conditions like dementia and Parkinson's disease. The age of onset and rate of progression are affected both by genetic and environmental factors. Improving diet shows subtle but significant benefits.
We found that the patients that they had increased intake of vegetables, fruits, olive oil, fish, and also red wine, they had a milder form of the disease and better disease outcome, compared to the ones that they had higher consumption of red meat and also the unhealthy dairy products. They had a higher risk and association with severe forms of Parkinson's disease and worse disease outcome. We know that the Mediterranean diet has an antioxidant effect and possibly also an anti-inflammatory effect, and is reducing the neuronal cell death.
Dr. Marios Pancharis is researching the role of polyunsaturated fatty acids in conditions like multiple sclerosis and Parkinson's. A large trial, due to be published later this year, of his patented high EPA, DHA and vitamin formulation, plus the Mediterranean diet, is showing protective antioxidant effects on the immune system.
We have seen that using high doses of polyunsaturated fatty acids, and there are other applications, especially in omega-3, we can see a significant reduction in the attacks and the relapses of patients. We have also seen, using the MRI scans, that there is a reduction in the formulation of new lesions in the brain. Patients are describing that there is a reduction in the intensity of their symptoms, like tingling, numbness, pain. Even they reported reduced spasticity, so they can walk more freely.
One such patient is Pavlos, who was diagnosed with MS nearly 20 years ago. He says his condition has noticeably improved since following this dietary regime.
Από τη μεσογειακή διατροφή παίρνω την ευεξία, ονομάζεται στα ελληνικά.
What Pavlos just said, using the word evexia, well-being, by using the Mediterranean diet, is that he feels much better by sticking on the Mediterranean diet and using some other supplements to increase the polyunsaturated fatty acids and antioxidants. He feels that he's stable and that he can handle his daily activities quite better, and he feels more confident about his control of the disease.
At the Institute's laboratories, researchers use metabolomics, the study of metabolites or intermediate end products of metabolism, to analyse how diet affects monogenic brain disease, conditions like Huntington's, which are caused by a single gene.
So in the diet, we'll be doing something called untargeted metabolomics. So we have a blood sample from our patients, and in this sample, when we use untargeted metabolomics, we'll be looking at all the metabolites present. And with the diet, we'll be able to see if a person consumes olive oil or not, if we find that specific metabolite, or any other harmful metabolites, for instance, that may be up or down regulated. So this is how we're connecting metabolites and metabolomics with the diet.
The findings may also help delay the onset or reduce the severity of other monogenic diseases like Parkinson's, Alzheimer's and ALS. It's early days, but the work here offers exciting possibilities.
With our studies, possibly we will find some metabolites that they have strong association, and possibly in the future they can be used as treatments.